Welcome to the Medical Manners Podcast, where I give healthcare providers simple tips for ways they can transform the way they connect with their patients and colleagues. Connecting with patients isn't some secret sauce that some of us have and others don't. They're just skills, implemented consistently over time. If you want to transform your medical practice, you're in the right place. I'm Katie Wyatt, your host. This episode is sponsored by the Connect Better audio course. This course is for healthcare providers who want to drastically improve their patient satisfaction or Press Ganey scores. Each week for 6 weeks, you will listen to a 5 to 10 minute audio training. Then throughout the week, your job is to implement the skills you're taught in every patient encounter. You'll be amazed at how much your score can improve in such a short amount of time. Go to medicalmanners.com and use the code PODCAST for 10% off the course. I have Megan Gibson with us here today, and I'm so excited to talk with you. Let's start out with you telling us about Peter and kind of how you knew something was wrong, how you went and sought medical care. Kind of give us a backstory on him.
Yeah, his story is interesting. So in 2020, he came home from school in February. So before COVID had really become this big thing. My kids ran in the door and they were like, Peter is crying at the bus stop and he can't walk. And so I ran out to the bus stop and he couldn't walk. I took him into Instacare. He had an infection in his hip joint. And because of that, we were in the hospital for a few days. He had to have surgery and he had to they removed and washed the fluid, cleaned it out. There was this whole thing. And because of that, it got us on this track with some doctors following up from this hip infection that he had, that we found the cancer. So do you want me to kind of tell you that?
Yeah.
So he had this hip infection and he had some follow-ups with the surgeon afterwards. And they had said, if there's more pain, come back. And he kept not feeling well. And so we would go back and he had like an x-ray and things. And the doctor had said, I'm not seeing anything that's wrong. Can I refer you to a pediatric rheumatologist? And just to kind of just to do some more digging. And so we agreed to that. And so we got that referral and we had an appointment set up for May. So there was a couple months wait and then COVID happened. And so because of COVID, we had this May appointment. They didn't want anyone coming to the hospital for visits like that. And so we had a Zoom call with a pediatric rheumatologist. And it's kind of hard to do that call over Zoom. And so we did that call and he was like, I'm not seeing any red flags, but how would you feel about coming back next month just so I can see you in person before I just let you go? And I was like, well, that's fine, So we had this appointment on the books for end of June and didn't really think anything of it. Honestly, the pain had gone away. Peter was having no symptoms, like nothing was wrong. So I was going to honestly cancel that appointment because I just didn't really see a need for it anymore.
Yeah.
And then our family was out picking strawberries at a farm and in June, and my husband looked over at Peter and he was like, Peter, your neck is really swollen. On the left side, his neck was just like there was this growth there. It was just sticking out. And we were like, did you get stung by a bee? Like what happened? And he was acting like he had no idea what it was. And so I took him to the doctor, just our regular pediatrician. And they said, well, let's do an ultrasound. So they weren't able to do it in office. So we left and we went to a lab and they did an ultrasound on it. And the doctor there just told me, this is totally normal. Kids get swollen lymph nodes all the time. It's going to go away in a month or two, nothing to worry about. And so I left and I came home and I told my husband, it's nothing to worry about. It's going to go away in a month or two. And my husband was like, I don't feel good about that. And I felt fine about it. I really wasn't worried. I was like, I guess this is normal.
Yeah.
And so that's where we were. So that kind of happened in June. And then it just turns out that the following week we had that follow-up with the rheumatologist. And so we went to that appointment and he was just doing his full body, Peter's just exam and feeling everything. And I know now that he looked at Peter and knew right away, this kid has something going on, but he didn't alert me to really anything. He did the full exam, asked me a bunch of questions, asked me about his neck, and I said, oh yeah, we already took care of that. We went and had an ultrasound. There were no problems. It's going to go away. He's like, all right, well, how would you feel if we just did some blood work just to kind of, dot all of our I's? And we just, so I agreed we could do some blood work. And he had told me, either myself or someone from this office will give you a call in a couple days just to let you know how that blood work looked. So I was like, perfect, great. So we did the blood work and then we left. And then the next day he called me on the phone and was like, hey, I'm really sorry. I knew it was wrong. I knew that something was up as soon as I heard his voice on the phone.
And not the nurse.
And not the nurse. He's like, I just want to call myself and let you know it's malignant or and just said we found some things in his blood. His just levels are just not looking great. I wanted you to know that I've already spoken to the team here at Duke. I have an appointment for you tomorrow morning at 9 a.m. with the hematologist, the oncologist team. They're all ready for you. They've already looked over all of Peter's information that I took. It's really important that you make that appointment. Can you make it tomorrow at 9 a.m.? And that started the whole process.
Wow. And how old was Peter at this point?
He was 6.
Okay. And at this point, is he still pretty much symptom-free other than the swollen neck? His hip's feeling okay?
Yeah, his hip was fine. And he really was symptom-free, except for his neck was swollen, was the only sign.
Okay. So then you meet with this team of specialists that's going to kind of start taking over on Peter's care. How long now is this journey of treating his cancer? What does that look like?
Yeah, so we met very last week of June, and he had a port placed July 15th, and then he was cancer-free beginning of October. So it was a quick process. We just hit the ground running, and it just boom, we start to finish. It went quick. It was really intense. We were in the hospital, I mean, most days, all day, a lot of nights stay. It was just insane. And then it was over. It was just crazy.
Wow. And how cool that you lived near Duke. Like you were able to still live at your home, right? While you were doing all these treatments.
Yes.
Wow.
That was a huge blessing. Yeah. Our drive to the Duke Children's Hospital was under 20 minutes. 20 minutes. Yeah. Mm-hmm.
Awesome. Okay. So what I try to do is I try to train healthcare providers on how they can connect better with patients. And so really, I feel like you, the patients and the family members of patients are the experts on this. And so is there anything, if you can think back on that journey with Peter, is there anything that any healthcare provider said to you or Peter that was meaningful or that helped?
Yes. I remember in one of our first, when we knew that it was cancer and we were going to be starting chemotherapy, we met with, she wasn't the doctor, but she was like, who was kind of bringing the team together. And she sat down with us. And I remember her saying, Peter will always be part of our family. We just want you to know that he's always going to be important to us. When he's an adult, we are always going to care about his health. Like he is now a part of the Duke Cancer family. We are going to love him forever and be on his team. And I just remember thinking, wow, it was so sincere and meant so much to me. There weren't great answers. It was just very heartfelt. And I could tell that she really cared about him and about our family. And I just thought we're in good hands here.
That's awesome. That's actually one thing I always tell healthcare providers. You've got to like think about what you would do if this was your mom, or what you would want done if this was your mom or your sister or your friend, and do that thing. So I love that you said that, because I think treating patients like they're your family, then we know we're giving the right care. Then we know we're doing it right. So I love that she said that, and she just started off with that.
Right. Yeah.
That's
and
cool.
that she was able to vocalize that. And I felt like she really meant it. So it really meant a lot. It was a great way to put that first foot forward and we're in this together kind of thing. And we're going to be on your team. We're going to answer all the questions that we can. We're going to work with you. She was great.
That's
So
awesome. What would you say the hardest part of this all was for Peter?
for Peter, I would say, well, two things. Getting his port accessed was very difficult. And also, I felt like the healthcare providers did a really good job at addressing him, but there was confusion for a little kid just not really understanding why we have to do X, Y, and Z. It's
Yeah,
painful, it tastes gross, you know. So that was difficult for a little kid, for
right.
sure.
Right.
Yeah.
Because an adult can understand this is going to hurt, but I understand why I have to go through this.
Yes.
And Peter couldn't understand that.
Right. Like, for example, having his port accessed, I thought it would get easier each time because the first time it's scary. But what ended up happening was he had more anxiety because he knew what to expect. And so he would freak out more when it
Mhm.
happened rather than it getting easier because he had that fear around it. And so
Yeah,
that was really heartbreaking. So
gotcha.
yeah, that was the hardest part for sure.
Gotcha. And what was the hardest part of it for you and your husband?
I think just watching him suffer was just so heartbreaking. Watching him get sick, um, watching him get his port access was really hard because you're trying to pin your kid down of this has to happen. I'm so sorry. This has to happen. And I really appreciated when the nurses would just sound like there were a few times they're like, Mom, like, and I trusted them of, do you want to step out and we can help get this to happen? Because once his port was accessed, it was fine and he was fine. It was just the anxiety. And so I
Yeah,
really appreciated the times when they would say, we can do this so that you don't have to be the bad guy and then you can come in and comfort him.
you comfort.
That really, that helped that part. That was a hard, just emotionally, that was hard to watch him fight back.
Yeah.
So,
Well, and you also have, do you have three other kids?
mhm.
So you guys are also balancing three other kids and work and life.
Yes. Yeah, a lot of other things to balance. And it was during COVID, so no one else could come except for one adult. So I was the only one that could come with him. And so my husband would stay home and school's canceled. We were in
Right.
year-round school, so we were in school during the summer, but yeah, so it was just everyone's home. No one can come to the hospital. There's no visitors allowed. Everything's
Oh,
locked down. We all have to wear masks. It was, uh, yeah,
what a
quite
what a
a time.
what a crazy time. Oh my word.
Yeah.
Okay, so is there anything that a healthcare provider did, like to ease Peter's anxiety, or any like actions you can think of that were done that were meaningful?
They always used age appropriate language with him to describe things. So that was really helpful. So they would describe medicine in a way that would make sense to him or his blood count. They would make things on they would take a difficult word and make a kid version of it so that he understood what was happening. That was really helpful. They celebrated all these different milestones. So like in cancer, there's all these different milestones, of each round of cancer, getting your port taken out or whatnot. They would make a big celebration. It felt like a big celebration to us. It wasn't. I mean, it was, they'd put streamers in his room. They'd have a sign that said his name, things like that,
Cute.
that just really made him feel special.
Yeah. And probably made him feel like he was progressing. Like, okay, I did that thing. I
Yes,
did that thing. Like this is going to end. That's cool.
yes, yes,
That's really cool. And that kind of brings up, okay, so you said they used age appropriate language with him, but obviously they needed to fill you in on what
yes,
was going on. And this is something that I think healthcare providers can struggle with. There are healthcare providers that are really good at connecting with patients, and there are healthcare providers that are really good at connecting with adults. And it takes a special person who can do both. And so, how did you feel like that? How did they do that? And how did it work for you guys?
well, one thing I really appreciated was they always addressed Peter first. So as soon as they came in the room, they talked to Peter first at his level and then they would talk to me afterwards. So they always saw him, were down on his level, talking with him, and then they would turn to me. So that was really helpful. Um, Repeat the question.
Yeah, just how they kind of navigated talking with him as a patient, but also you're kind of the patient because you're the mom, and how they,
Yeah, they just did a really good job of kind of describing it for him, and then they would turn to me, and well, they would always ask Peter, do you have any more questions, or is there any, they would describe this, do you have anything you want to know? And then if he would ask a question, they would answer that, and then they would turn to me, okay, now you, mom. They would, do the same spiel, but in bigger language. And even still, that went over my head because I don't know anything that they're talking about. A lot of these terms I've never heard of before. So I'm learning. I felt as young as Peter in all of these different terms they're throwing around. But yeah, they did a good job of just speaking to both of us and then always pausing to make sure I understood what they were saying and
That's
just
awesome.
asking.
Well, and something I thought was really interesting, I interviewed Dan DeCuster. It was so interesting when I asked him what advice he had, kind of for us healthcare providers. He said they were always really good about saying, what questions do you have? But he said, I had never had cancer before. It was a whole nother world. And so he said, I literally did not know what questions to ask.
Mm-hmm.
And so he said, it would have been really helpful to me if they would have said, these are some questions that people typically have in your scenario. Do you have any questions about this? And he's like, that would have helped me know, like, what do I even ask?
Yeah.
And I thought that was a really good point because we're always like, what questions do you have? And usually patients are like, nothing, And
Right.
so kind of being there, like you're the expert, help them know what to ask, or maybe give them, do you have any questions on side effects of medication? Do you have any questions on what the next couple of weeks will look like? And kind of like guiding that. And I thought that was really good advice.
That is really good advice. One thing, now that you said that, made me think of, I remember them giving me a timeline, and I remember them writing it down of, this is what chemo is going to look like. It's going to be 21 days. And then putting like, you're going to have, his port's going to be accessed on day 1. You're going to have a mixture of shots, pills, or oral liquid he's going to take at home, and then them saying, this is going to be day 1, this is going to be day 2, 3, 4. Then you're going to have nothing. Then we're going to jump to day 7. And so I remember them kind of like writing that out so I could visually see it. And then something, at least, I don't know if this was the same for Dan, but it jumps from, you have day 1, 2, 3, 4. Then you have meds on 7 and 8. And then there's nothing until day 21. You start the whole thing over again. But I do remember it being very helpful. They said, just so you know, day 10 is when everything's going to hit. You're going to start, you're going to feel good. You're going to think that everything's fine. Day 10 is when the side effects are going to hit. So just keep that in mind. And it was truly clockwork. It would be day 9. And I'm like, it's fine. Even day 10, middle of the day, it's like, they were wrong. Nope. It was like by the end of the night, he had a fever. We had to be back at the hospital for 5 days. It was a whole thing. But it's like they knew, it was like clockwork. But them writing that down and just kind of showing me, this is what it looks like for most people. And this is what it's going to look like for you, basically.
Yeah.
Not that you don't know, or it might not, it's going to be different, but we've done this enough that day 10, plan on it being hard. Day 9 is going to be fine. Even day 10 in the morning might be fine. But by the end of day 10, just know it's going to be rough. And having that timeline, it really was like clockwork. I was like, they knew. It really was. Just like they said would happen.
And it just helps I mean, I'm definitely like a planner, like give me a list, give me a schedule. So it really does help, like as a mom, okay, when could I plan on doing some things with my kid? When should I absolutely not plan anything? That's so nice just to kind of know what's coming forward. In my opinion, pediatric oncology teams are the GOAT. They are so good at interacting with children and their parents that I just wish all the rest of us that deal with pediatrics could observe what they do. Theirs is a special work.
Yeah.
And I think it's inspiring. And so it's cool to hear about your experience with that because I think we can all learn a lot from them
Oh,
for
for
sure.
sure. I felt like the nurses that we had there were just literal angels. There wasn't, I mean, from the front desk check-in on that floor of the hospital, like, because no one was there for something minor. Like everyone's there for
Hmm.
something huge. You know, if they can walk in, that's great. Most kids are pulled in their wagon. They cannot even walk, you know, like everyone was just so sensitive. And something just on a personal level, I felt like everyone knew who we were. The whole team, like people would come in and just they would say hi Peter as we would like, you know, we'd start with our check-in with, you know, his weight and all of that stuff, then to the room where the doctor would see us, then we'd go to the center for the chemo treatment. It's like we just had nurses that even when they weren't our nurses, they knew who we were and they would say hi to Peter and use his name. It just felt like everyone was just rallied around us. It was such a friendly environment.
That's amazing. So people that even really didn't know him,
Mhm.
like they probably had just looked at his chart to know this is Peter,
Yes.
but they called him by name
Yes.
and
It's
they
like
knew
we
him.
must have had like a morning huddle meeting where they were saying, I'm sure that's what happens of we have these patients coming in today. This is
Yeah.
what's going on. Like they knew who we were, even if they weren't Peter's nurses. We usually saw the same people every time, which I loved that, but everyone knew who we were.
That's amazing. So one thing I ask healthcare providers to do is every visit, I tell them to ask the patients about, I use the acronym FORD. So about their family, their occupation, their recreation, or their dreams, right?
I love
Anyone can talk about one of those things, every single person. So talk about one of those things, but then realize that you aren't going to remember. I mean, your case is a little different because you were seeing the same people very regularly. But for the most part, I see a patient and I don't, if I see that patient again in a month, that's quick. And typically, I don't see that patient for 6 months or a year. And so I'm not going to remember. I'm just not. And so you have to chart that. Like you have to chart in your chart what you talked about. Okay, they are going to college and studying English. They're working at Red Robin. Then the next time I see them, I take literally 10 seconds and I look back. I'm like, oh, yeah, she's going to college and she's a waitress at Red Robin. And then when I go in, I'm like, how's school? Are you still working at Red Robin?
Yeah.
Okay, that patient literally thinks I remembered her. And truth be told, I probably didn't, but just the act of going to the effort to remind myself, that means a lot to patients. I think. I think that's meaningful.
Oh, I totally agree. Yeah, I totally agree because for you, it's been a year. For them, you're probably the only healthcare provider that they've seen. So they're going to remember you more than you're going to remember them. And so, not that they're going to expect you to ask me about my job at Red Robin, but you're that figure that we had this conversation last time. You've seen 1,000 patients since you've seen them. I think that makes a huge difference. When I asked
Um,
Peter what stood out to him, he said, I remember Dr. Geddes, he was our fellow. He said he was always so nice to me. And he's like, he would always ask me about soccer and about the things that I like to read about. And he's like, and he always knew, he knew that I liked soccer. And of course, in my mind, yeah, I mean, we were seeing him a lot, but I knew that he had made a note of a chart. And Peter remembered that, you know.
yeah.
So
Yeah. And Peter's, how old is he now? 9,
he's
10?
10 now. Yeah.
Yeah. And he remembers.
Yeah. Hmm.
How cool. And Peter, for the record, Peter's great now, right? No problems.
Yes. Peter's fantastic. Yep.
Awesome. Okay. Well, as we close, is there any advice you can give us as far as what means the most to patients? What can we do if there was one thing that we could focus on and be better on? What is that thing?
I would say just seeing people as, like you were saying, a family, of making that eye contact, especially when they first come in the room. Like you can tell if someone's in a hurry when they first step in the room, because if they go straight to the computer and sit down and they haven't made that eye contact with you, I'm already kind of on edge of I don't want to ask a lot of questions because I can tell they just hurried in there. So they probably have someone after me. And I'm such a people pleaser that I would say just that first connect emotionally first before you do any next step. And then that's going to make anyone feel more comfortable to ask the questions, to then remember, oh yeah, this thing did happen. I wanted to bring it up. It felt like not a big deal, but I want to bring it up. So
Yeah.
yeah, I would say that connecting eye contact on that first step. And then also just celebrating people. Like the way that Duke celebrated Peter in his cancer was just amazing. So just remembering and celebrating, asking questions. But
Do you want to give any shout outs to providers or offices? I kind of like to send these people a kudos because I think it's important that
oh
they
yeah.
get celebrated for their work. So is there anyone that you want to shout out who just stood out in his care?
Oh, for sure. Dr. Geddes, he was our fellow and he's now in Florida. So we saw him for our last time last year. And I was so devastated that he was going to work full time in Florida. He was amazing. Oh my goodness. Like, I can't talk about him without just breaking down because he was just a light. He was so good with Peter. He was so personable, so kind, funny, just he was amazing. So Dr. Geddes was amazing. Honestly, the surgical team at Duke was awesome. When Peter had his port removed, they had pom-poms, bubbles, music. When they wheeled him back, they played Celebrate by Kool and the Gang and they blew bubbles and the whole like I have a video of them like rolling Peter to the surgical room, and all the nurses are lined up waving their pom poms and bubbles, and Peter's just like, "Where am I going?" Like it's a party. Like they just celebrated everything, and then
Wow.
also his surgeon that did his hip. I'm so thankful that he gave us that referral because he didn't know what to do next and didn't have any answers. So I was so glad he didn't just say, kind of like what we had with the ultrasound of it's going to go away, don't worry about it. He was like, let me just give you a referral so you can go ask your questions because I'm not seeing anything on my side. So I don't remember his name, but that really got everything started. I was so thankful for him of just giving us another person that we could talk to rather than just saying, it's fine, you're good, go home. So,
Well, if he wouldn't have, Peter's symptoms were going down. His neck was swelling, but you were told that was okay. So
yes,
you really would not have done anything for quite a while, probably. And it might have been a different outcome had that not happened.
yes, I never was worried he was going to die, but he was at stage 2 and it was
Hmm.
it was growing very rapidly. So I many times I was like, man, what if we would have just been sitting here? I mean, his treatment was done in a few months. It could have been a couple months of us doing nothing.
Yeah.
And, how much longer would his treatment have been? So that was another thing of just, I was really thankful to a doctor not just shutting us down saying, you're good, don't worry about it, but hey, let me give you another follow up. Let me give you a referral.
Well, and I love that because something I'm all about is I think it actually builds confidence. Some healthcare providers, especially when you first get out, you feel like you need to know everything and you feel like you're an idiot if you don't know the thing, right? But I actually think it builds confidence in patients if we're really confident in what we know, like this is what I know, this is what I'm good at, but we are equally as confident in what we do not know. And
Yeah.
we're like, this, I do not know the answer to this. I am going to reach out to someone who does, or I'm going to refer you to someone that does. That is something that builds trust. And just like you said, that was a game changer for Peter when that doctor said, I don't know. So I'm going to send you to someone who may.
Yeah. And honestly, it's like I feel like as the patient, you don't expect that one doctor to know everything, but they're the one who has the team that can get you the answers. So if
Yeah.
I have to go home and now be trying to, Google what could be happening, that is so overwhelming. But just knowing that I have my main point, and if they don't know, they're going to help point me in the direction of where I should go next. I
Right.
don't think anyone's going to look at their one doctor and think solve all my problems, but
Right.
help me know what path I should go down, even if it's
Right.
not. So
Right.
yeah.
Oh, I love that. Well, I'm so glad that Peter is good. And I'm so grateful for you for taking your time to chat with me. Thank
Yes.
you.
Yes, it was so fun. And it was fun to go back and remember all this. I'm like, wow, that was such a miracle. And shout out to Duke University Hospital. They were incredible. What an awesome team. We were so lucky that we got to work with them. So
Well, that is so cool. And I'm going to give them a shout out. And yeah, thanks, Megan. You're the best.
Yes, thank you.
Thanks for listening. If you enjoyed today's episode, the best way to support what I do is by rating and reviewing the podcast. Your feedback helps me reach more listeners to make an even greater impact. It would also mean the world to me if you would share it with a friend or colleague who you think could benefit from the topics we discuss. Together, we can transform the way we deliver healthcare by transforming the way we connect. Take care.